Kamanutietab soromok eng borto ko kocher tuguk chemamakat eng korotik che naat ko waste. Akot kounoton, ko kokwo barak mionwekab soromok mising eng lagok.
The younger generation can also be affected by kidney disease, and these are genetic diseases, right? Most of the time, when one of the most common cause is what we call reflux disease. Okay, you have the bladder, and then you have where you pass urine, and then the ureters are connected to the kidney, where they drain into the bladder. So what happens is there is a valve between the bladder and the ureters, and if that valve is not functioning very well, the urine starts going up into the kidney instead of coming out when they want to pass urine. So that affects the kidney. Okay, and if it stays like that for some time, the kidneys get scarred and the function deteriorates. That's one. Second one, we also get something called nephrotic syndrome, inflammation in the kidneys in children. And again, if that's not picked up early, then they get kidney problems. And again, other diseases, things like sickle cell disease, malaria, infection itself can all cause what we call acute kidney injury. And if it's not treated well, then it can lead to chronic kidney disease.
Kotinye kenyisiekab 8, ko kisich kaimutikab soromok Hope Mutete, kit nemanai kole wale sobenyin tugul.
I had complaints of pains in my stomach, and I'd go to hospital and get tested for malaria every single now and then one time I went to one of the hospitals in Nairobi and I was diagnosed with kidney problem.
Ako imuche inaitano kole itindoi kaimutetab soromok.
In terms of kidney disease, when it's getting towards the end stage or more severe form of kidney disease, the symptoms include swelling in the leg, blood in the urine, a lot of frothy urine. When you start peeing and you see on your tub, there's so much froth, just like the way the beer froth, right? And that is you're leaking protein in the urine, or you're getting tired very quickly, or you have nausea, vomiting. That shows that you have toxin buildup in the body, and you can't really eat much food. You don't have appetite. You have a headache. You just want to sleep. Those are some of the symptoms of kidney disease, but that happens towards now, let's say stage 4, stage 5 of kidney disease. Earlier stages, they don't have any symptoms, so preferably people who have diabetes, high blood pressure, they get kidneys checking at least every 6 months or every year, because those are the main diseases which cause kidney problem. And obviously, if you're above 40, then at least get a routine check done.
Kanda kisich Hope mioni kingoming'in ako kimanai akobo kaimutikab soromok, ko eng nguni ko kamwa inendet kole ui sobet kwa sipitali ak sukul en kila wikit.
When he started dialysis, it hit me so hard because I realized it was emotionally draining, mentally draining, financially draining, and it hit me, especially mentally. I couldn't imagine because I had to find a balance between school, personal life, and hospital 2 to 3 days a week to find time to go to hospital, like go there 5 to 6 hours. So it was quite difficult for me mentally. Because of the support of NHIF, that has lifted a burden on kidney patients, because if you're doing 2 sessions in a month, they'll sponsor around 75,000 shillings. But when you're doing 3 sessions, and especially the hospital that I go to, 1 session is 12,000 shillings. So 12,000 times 3, that is 36,000 a week.
Kosubkei ak Dr. Sakwala, kanyaisetab soromok kotinyegei ak ole kakoit. Kora, kanyaisoniton ak kirindaetab mioni ko kit agenge.
So kidney disease, ranges from stage 1 kidney disease to stage 5 kidney disease. So stage 1 is mild disease. Stage 5 is severe disease where you need dialysis. That's for chronic kidney disease. And then we have an entity called acute kidney injury. That's when your kidneys are fine, and then suddenly, for example, you get an infection, you go into the ICU, or you're getting admitted to the hospital, your blood pressure goes down, your kidneys don't get enough blood, and then they go into a shutdown phase. Okay, they go to sleep in layman's term. And because the toxins build up in the body, you need to help the body by doing dialysis, taking over the function of the kidney until the kidneys start recovering by themselves. So that's acute kidney injury. So we'll talk about chronic kidney disease. As I said earlier as well, the most common cause of chronic kidney disease is diabetes, followed by high blood pressure, followed by something called glomerulonephritis. In this part of the world, we see a lot of glomerulonephritis which is missed, which is not picked up. That's why we have very young people who are on dialysis. Okay, in the West, we have older people, mostly because of the diabetes, the high blood pressure, which is causing the kidney disease. And if they get glomerulonephritis, they're picked up early. Here, people with glomerulonephritis don't see the doctor, or if they see the doctor, they're just treated like urinary tract infections and sent home. You don't get a kidney biopsy, you don't treat it adequately, and your kidneys end up, dying off. Okay. So we've talked about the symptoms and prevention. Okay, and treatment is mainly prevention again. Okay, avoid painkillers. Healthy lifestyle. It's a multidisciplinary approach you can do. Regular exercise, adequate fluid intake, reduction in salt intake. And then now we go to specific treatments. Then if you have diabetes, which is causing your kidney disease, then better glucose control, okay, better sugar control. It's not like your sugars are very high, they affect the kidneys just like they affect other organs like the eyes, the heart, the nerves. They also affect the kidneys. So make sure that your diabetes doctor or yourself maintain your sugars very well controlled. High blood pressure, again, make sure your blood pressure is very well controlled, okay. Below 130/80 is what ideal we want, systolics of 130 and diastolics of 80. Anything above that will affect the kidney because all that is pressure to the kidney.
Magat en chi agetugul netindo kaimutikab soromok korib amitwogikyik.
One thing, healthy lifestyle. Number one, avoid your fast foods, avoid, your junk foods, regular exercise. If you have any problems like the ones I've mentioned, swelling in the feet, blood in the urine, frothy urine, facial swelling, feeling unwell, nausea, vomiting, see your doctor as soon as possible. Ask them to make sure your kidneys are okay.
If I want to eat probably something with potatoes, I have to soak them 4 hours prior. And it doesn't have tomatoes, and I don't deep fry. Yes. And like if I want to eat something with beans or something, I have to soak them 12 hours in time. And also when you're eating something like chicken or fries, you have to air fry them or put them in the oven. You can't eat oil. Yeah, you can't eat oil, deep fried foods. Yes.
Bo kamanut biik cheribe chi netindo kaimutikab soromok anan ko caregivers kamun mache bichu cherset neo eng kanyaisenywan.
For any family member that goes through that kidney journey, I believe they need a support system. It's not easy to eat different meals, to have a different kind of lifestyle than other people out there, and I believe that they need a support system.
Yes, so this is a chronic problem, yeah, and that would be the best thing if the caregivers know how to take care of these patients. So obviously giving them a little bit of education on how to take care of these patients, what to avoid, what to do, it goes a long way.